Good morning, everyone. Welcome back to Sun Up on 7. It's Wednesday, and everything today is wellness themed. If you missed our first two conversations, let me remind you that there's the second COVID booster available for vulnerable populations. So that includes folks that are 50 years or older, frontline workers, and persons that have any immunocompromised condition to go and visit any Ministry of Health clinic to get your booster shot, do your part to stay COVID-free and stay healthy. Our second conversation was talking about brain injury awareness, and there's a Bikers Fest happening this Sunday at Digi Park starting at 12. So go ahead and support and learn more about how to protect your brain, and of course, how can you participate in the many activities that they have. May is Mental Health Awareness Month, so we have folks that are working within the mental health sector. We have representatives from Health Connect Belize and the Hub. So we have Martin King, Director of Mind Health Connect, and Krista Courtney, Counselor at Health Connect as well. Good morning, ladies. How are you feeling?
Pretty good.
Good morning. Pretty
good. I love the bright colors.
Not a morning person,
But you guys are, I like the colors too again.
Yes.
I'm really like what our guests are wearing these days. Like, to come with some nice colors.
Yes.
I don't know what.
Y'all look like your morning folks, though.
The coffee did it for me.
The coffee did it?
The coffee
Right.
did it for
Miss Courtney
me.
said she
Yes.
don't have a coffee yet, so we're happy that you're
But
still
she might just
functioning.
be an undercover morning person,
There you go.
Because no coffee yet.
And we're also joined by Onando St. Bernard, Director of the Hub. How are you doing, Onando?
Hello. Doing pretty well. Doing pretty well this morning. Not so anxious as last time, right? But doing pretty well this
There
morning.
you
Thank
go.
you.
The couch is a thing where it comforts you, right? The green and the
Yeah.
texture and
True,
everything does the thing.
That's why in our
If you get
counseling
stressed,
rooms,
you just, do that,
yeah,
Feel it,
that's why in our
right?
counseling rooms we have the nice couches for you to feel comfortable and relaxed, so that we can have the conversation.
I
There
fell
you go.
asleep in a counseling room already. The couch is really good. So,
Yeah.
but talking about counseling, just mental health awareness, I think, like I was telling you, I feel like mental health month should be like a specific month only with mental health, because it's such an important conversation. It's such a needed conversation. And although we're always talking about it, I think we're still not doing enough about it. So I want to know what's going to happen for this month when it comes to the activities to help promote mental health awareness.
Okay. So Health Connect Belize is a mental health advocacy group. And there are other, obviously, people and organizations that fall within mental health in Belize. But our role is to advocate for reduction in stigma. And one of the most important things we've always wanted to do and continue to do is to be able to provide resources. And that's something we want for Mental Health Awareness Month. And we're going to be going on social media and on media outlets throughout the country, especially outside of Belize City as well, because a lot of the resources are within Belize City, to highlight our website or contact numbers. So we, Health Connect, don't provide any services per se, but we have the website, we have our help numbers. You call and we'll say, okay. And every week we have people emailing, people calling, where can I get help for this? Where can I get help for that? And we will point them as much as we can to the resources that are available, so that they know as Health Connect, we want people to know you really don't have to suffer in silence. You are not alone, which is one of the biggest things. Now, we've seen a reduction in stigma. COVID helped. But before COVID as well, we were already seeing people reaching out to us before they were in utter crisis.
Yeah.
Before, it was like counseling was the last, okay, nothing else never worked. I go in there because I don't have another option. We're seeing less of that and people being more proactive. And so conversations like this help in furthering the reduction in stigma and just really letting people know that you're not alone.
That's definitely true.
And that it's okay to go to a mental health therapist, right?
Right.
There's nothing, as you're going to go.
Not just because you have a problem, though. I want to really push that point, because I think we always just go to counseling or therapist when we think we have something wrong with us. You can just go when you're good and dandy, work out some maybe past traumas that you didn't know you have. So people, just please remember that too as well. Let's not think that it's only for people that are in need of the counseling. You're always in need of counseling. To me, I think there's something to unravel within you.
Mm-hmm.
So just
that's really important. It's this idea of only for crazy people or weak people is so antiquated. Like, that's been done and disproven over and over and over, you know. It is not only for mental disorders. Mental health is on a spectrum, and we all have mental health, and so we need to take care of it. I think COVID did a great job of reminding us that we need to be able to take care of ourselves, and it has nothing to do with mental disorders or mental illnesses. It's just really where we are on that continuum to take
How we're
care of
coping.
ourselves.
I kind of like to think of it as how you drive is more important sometimes than where it is you're trying to go. Because you can drive really reckless, you can be really careless, you can be under the influence, you can have all these other issues that impact your ability to safely get you wherever it is you're trying to go. So you can pick a lot of different destinations, if it's college, if it's healthy relationships, if it's being a healthy parent, if it's trying to, further your career. But how you drive can absolutely impact how you get there, when you get there, what condition you're in when you get there,
That is
how you
so
function
true.
when you get there.
Right.
And so therapy actually can have a really preventative impact in your life. So it can prevent the worsening or the onset of severe disorders if you are able to get help early. So anytime you have a reoccurring problem, whether it's financial, if you seem to cycle through the same types of relationships, if you're not meeting your goals with your kids or in your career or just personally, like you want to take better care of yourself, but you don't know how. Like any of those things that keep recurring, and it's like, I wonder if I should see somebody for this. The answer is yes. See somebody. And if you're better off, if you're better off than you think you are, you may only need a few sessions just to confirm it and let you know what to look for in the future. If you are a little worse off than you think you are, then you're in the right place to get personalized assistance.
Right.
I really appreciate you saying situations too as well, because I think that makes it a little bit more personal for people wondering, do I need to go to get counseling? But if you're struggling with parenting and like it's just too much for you or whatever it is, maybe you need to do some time management and figure out what's going on. If you're having the same relationships and somebody always broke your heart and you're wondering what's going on, like maybe I need to get some
But think about it. A
counseling.
lot of people say, every relationships have their ups and downs. As a parent, you're always stressed out. Like you're never supposed to be without stress. And that's true. But how you manage that stress, how you treat your picnic, how you, take care of yourself as a parent so that you can really see your children and their needs, all of those things can be improved. You can feel more capable and more able to handle those things without feeling like you're at 100 every single day.
Yeah.
Right.
That's not healthy.
And I also appreciate that you gave us some examples of things that might lead you to go to a mental health therapist, given the fact that Mind Health Connect, in their website, they have a directory of very specific things that you can go for, which I think is absolutely brilliant. And it can tell you in which districts they're located, who will be your therapist, how they look, and their background, because we need to know how we're going to be connecting with them and make us feel comfortable and build a rapport to being able to make the best out of every session. So mindhealthconnect.com is the website. And one of the reasons we did a website and something that's not printed is because a lot of people don't know where to go for help. So we want you to be able to find that resource in the privacy of your own phone. Everybody has a phone. Everybody has access to internet somewhere, somehow, at some point in time throughout the day. And people often want help, but they don't want to ask somebody, who do I go to? And then if they did ask somebody, I don't know. So we wanted to make sure that the resources were available to everyone, everywhere, whenever you feel like you need to. Maybe I'll just peruse the website. Even if you don't make a decision, send in a question. We're the ones that are answering it. It's not some random person. But the idea is that you have access to a directory of resources. And one thing, as a mental health counselor myself, I was not too excited about virtual sessions. COVID kind of mandated that, and now the majority of my sessions are virtual. But we're realizing that it allows people, even from districts that don't have in-district representation, like an actual physical location, are able to access resources virtually now. And that has just been phenomenal.
Yeah, because it opens up the horizon. Like people maybe in PG that don't have the finances to go somewhere in Belize City.
Just
but
the
they
travel
can
expense.
Yes, and maybe they
alone.
can just go to maybe an internet cafe, because there's options where you can see. I'm not sure if you guys do, like, I know some people are saying they do WhatsApp call because the internet and they have that. But there's options where you can get that support without having to move from your location. Because for all you know, you need to take care of your granny, and not that it's stress with the cards are right now, and you need to be at that place. But I think that opens the opportunity for people out
It really
there.
did.
Definitely. Orlando, let's bring you into the conversation.
Yes, I'm very happy that we are partnering because you'd be surprised how many times I get a call saying that they didn't know counseling was free in the country. And then they go on to talk about the different issues that they've been going through and whatnot. And it's somewhat heartbreaking because if they had known, they would have accessed the service, as soon as they could have.
Right.
So I'm really happy that we are partnering and that we have this service at the hub to provide free counseling for anybody who seeks it. The thing, though, is that we are mainly based in Belize City. However, we continue to try and push to get a physical person in the different districts. We also do teletherapy as well. We've done the trainings for teletherapy because, again, we have to be careful of confidentiality and things like that. And while we are taking that into consideration, we're also trying to work at the level of our clients in the sense that if they do not have the platform that we think is more secure, we work with them through WhatsApp, to be able to assist them the best way we can instead of creating barriers and blocks and things like that. So we continue to push. It's an upward battle constantly with regards to getting these offices in the districts set up for counselors. But in the meantime, teletherapy seems to be working. It should also be stated that with teletherapy, there are some cases that we can do via teletherapy and then other cases that it is better in person to provide the best service possible. Because in some cases, teletherapy will not do it justice, So we do have to be careful of that as well. But yes, with the conversation earlier, it's also that I just want people to understand that it's okay to not be 100 all the time. Because we're human, we're living in the society that we're living in, and there's lots of stress, lots of isolation, loneliness, all these things, social issues that we're all going through. And so it's okay to not be 100 all the time. We're only human.
Thank you for reiterating that. It's very important for people to resonate with that. Ananda, I want to ask, you mentioned that counseling services are available at the hub.
Yes.
Yeah. How can people access it? Is it age specific?
Sorry to cut you off. It's all ages from 5 and up. You can access it by walking in, giving us a call, going through Mind Health Connect, sending us a message through our Facebook page, Community Counseling Center. These are the different ways that you can access the services. Call us at 227-1406. All these different ways for people to access the services.
Thank you for sharing that with us.
Can I just ask on your social media, the hub, it's called the hub, or what is your social media?
So we're under the hub, and the hub is under the Community Rehabilitation Department. But the Community Counseling Center is within the Community Counseling Center is within the Community Rehabilitation Department.
Okay.
But we're housed at the hub.
Okay. You know what? Let's break there. Thank you so much for that. So, okay. We're within. So
Okay, so let me start with the Community Counseling Center. So the Community Counseling Center is at the hub, and this is on Lake Independence Boulevard. The hub is under Community Rehabilitation Department, which is under the Ministry of Human Development. I hope that's clear.
Yes.
no, that was better because the first one was like, okay,
I was all over the place.
and I was like, okay, I'm trying to keep up.
We get it because we're used to the name.
Right.
But
I can tell how our guests were probably like, wait, where we go? Just go to the hub. Just go to the hub, and that's gonna work.
So you've shared with us where can people go ahead and basically seek out assistance, seek out help when it comes to mental health. Is there any other activities happening for the month that Mind Health Connect or the hub is coordinating?
For Mind Health Connect, we're really focusing on letting people know about the website, letting them know about the hub and the free counseling, because that's where a lot of people reach out to us. So, and one of the things, again, like we particularly wanted to do was, to be able to get into radio stations and local TV stations within the districts where there's less information. So that is our focus for Mental Health Awareness Month, to really let people know that there is help and this is a place that you can go to look for help.
Beautiful.
Martine, I know there's this stigma or there's this conception that, counseling is not necessarily free like we could get at the hub. So on your website, do you state, where it's free from where it's not free and all these things so as well, and who's like specialists so people can know that like, all right, I need marriage counseling because X, Y, and Z, things they hit the fan and it probably have to pay for this, or as compared to I'm not having to pay for somewhere else. So is that also on the website?
Yes. So we have government resources and non-government resources. And under the government resources, you'd find, for example, the counseling center. You find the mental health unit and all the services they offer per district. So each hospital has a psychiatric nurse practitioner. Some districts have a psychiatric psychiatrists in the hospital. So, and then we have professionals in the field. And as you mentioned, if you go to each, they will then have their specialties, what their prices are. And so there is that distinction. And then the other thing that the site offers is gyms, AA groups, anything else that falls under wellness. So if you're in Toledo, you go to Toledo, and as many resources as we could find. So if we're missing anybody and they're listening to this, please, we want to know those resources.
That's beautiful. That mental health is not just focused on going to a counselor or a
No.
therapist, but there's many ways.
Wellness.
It's holistic.
It's exactly
Holistic,
right.
And
yeah.
wellness.
Yeah, so these are the private practitioners, and this is on the professionals in the field. You click, you get information on each, and we get excited every single week, every single day that somebody reaches out, either for this or for any other help in mental health. Because
I love the photos.
I know, they look so nice. I saw Miss
They're
Priscilla
gravitating
there.
the energy there.
Yeah.
It's like, I want to go and have a
Yeah.
conversation in one of those.
we want to be warm and inviting,
Yes,
and
it is.
and again, this idea, and I often remind men that I'm not picking on them, but I feel like so many of our men are struggling. It's not a woman thing or a white people thing or a crazy people thing. It is a human thing, as Anando said. So please ask for support, and we want to remind you and everybody that we can help with that.
Yes.
It's not magic, but you're not alone.
Right. So as you're wrapping up this conversation, Krista, do you have any last words to share with our viewers?
I just want everybody to know, visit Mind Health Connect, even if it's just to peruse what's there. And anybody out there who is a provider licensed, please feel free to reach out to us if you're not on the site, because we want to get you on the site. So some people we reach out to are waiting to get their
Is there a
information.
charge?
We continue to update it.
So
At this
just-
time, no.
Okay, just I want to, because I know for people that are, they charge for their service, but they want to be featured on a thing. I'm glad that there's not a charge, so at least we know there's access to these services out there.
Yeah.
Correct.
I also want to quickly pinpoint that somebody was saying that I'm extremely depressed to the point where I'm getting physically sick. So thank you so much for this. So definitely you can
beautiful.
go to Mind Health Connect, and right there on that website you can go and find the different sources. They're promoting right now all the different resources that are available for you. So for everybody out there that's struggling, you don't have to struggle. Please understand that there are sources out there in Belize. It's not like we have no hope alive.
Exactly.
Yeah.
Please go out and check and get the necessary help. Don't worry about what anybody else has said about it.
Yeah.
Left them and feel whatever they want to feel. You go and get the thing that you need to rejuvenate yourself. I think it's super important that we take care of ourselves and worry less about what's happening in the crowd.
One more note.
Yes.
It is important to notice that those who are working and might have insurance through their companies, some companies actually provide an employee assistance program, so they provide counseling for their employees. But those that don't, at least Sagicor, I know, I'm not certain about RFNG yet, but they are covering mental health counseling sessions now up to 50% of the session fee, up to 20 sessions per calendar year. So those who are working and might have an insurance program, like they're on their company's insurance plan. So you have health insurance through your company. The company insurance policies now are covering mental health counseling sessions, not just psychiatric sessions.
Great.
Ms. Courtney,
Thank you
on
for
that
pointing out.
same note, sorry, I know we're wrapping up this
Yeah.
segment, but that's super important because you mentioned work, and now I'm
Right.
thinking about the people that are working. And so is there a thing where we can, because I know counseling sessions are probably like, Monday to Friday too as well. So is there a thing where we could do on Saturdays too, or
Everybody has their
Sundays?
own, each
Okay.
counselor will have their own hours,
Yeah.
but we are absolutely aware. I mean, I work till about 7 almost every evening, and Saturdays absolutely are a thing, but it's just by counselor and availability, their own
Perfect.
personal preference for scheduling.
And it's trying to the best of our ability to be client-centered, right?
Thank you so
Working
much for
around
that.
the clients.
Because
Right.
I know there's some people that work up till Saturday and like maybe Sunday is the only time they have off. Or
Yes.
So for people out there, don't think that because you're working 6 days a week, like all of these questions are being answered, guys. There's so much
Yeah.
resources. And
Feel free to continue to ask us on the site. We're happy
Yeah.
to answer as much as we can.
And please
These are the
remember,
ladies that are answering, guys, by
Yeah.
the way, so you know.
just remember free counseling at the Community Counseling Center. Professional, confidential counseling.
At
Confidential.
Independence
Yes.
Boulevard. Yeah?
Yeah, Lake Independence Boulevard.
Lake Independence Boulevard. Awesome. Thank you so much
Thank
for
you
being
so much.
here.
Thank you
Thank
for
you,
having
guys.
us.
Thank you.
Conversation on
Okay.
important to talk about
We look
mental
forward
health.
to that. And we're going to be highlighting also again throughout this month because like remember keeping the conversation alive. Again, the resources available so people can know.
Yes.
Mind Health Connect has a huge central
Yes.
pool of information, guys, where you can be able to know the representatives out there that can be able to help you in different areas. Do not struggle by yourself. Do not take this by yourself. You never know. I know the days are dark, but we have people, professionals that are confidential, that will be able to help you and assist you to get back to a better path. So with that, we go to our next commercial break. But when we're back, we're sticking to health and families and all this stuff because, man, they do the most. And so we're going to be talking about International Day of the Families. So stay tuned for that exciting conversation. If you didn't know about it, hello, we're going to learn. So stay tuned. We'll be right back.
Thank you.